Good morning, everybody. Happy Tuesday. It is my favorite day of the week, and many of you know why, because today we are here to celebrate a book launch. So I am here with Cheryl Field, whose new book, Prepared, A Healthcare Guide for Aging Adults, is out today in ebook. And I truly believe that this book could not have come at a better time. I'm going to let Cheryl tell you a little bit about it, but I think it is something that can benefit anyone at any stage in their life, because we all have, older adults that are experiencing healthcare changes, and even for ourselves experiencing these healthcare changes. So Cheryl, it's book release day. It's so great to be here with you.
Good morning. Yes, it's a very exciting day. Feels a little surreal, to be honest. Saying that you're going to launch the next day, and when you know that you've been thinking and preparing and actually doing some writing. For me, it was over 10 years to get to this day. So it's really a very exciting day. It's a day that I'm grateful for the team around me that's been able to support and take an idea and a need that I saw in the space for care providers and for those of us receiving care, and put it together into a useful guide. So it's a very exciting launch day indeed.
It really is. So Cheryl, can you tell us a bit about Prepared, what the premise is and who it's meant to help?
Absolutely. First, let me tell you a little bit about who I am,
Yes.
and I think that will help to answer that question more completely. So I'm a nurse. I have a master's degree in adult ambulatory care, which means that I've spent a lot of my career focused on preventative health for the senior care population. I worked as a nurse in direct care in the nursing home space. And behind Prepared is really this goal of getting ahead of changes in health that unfortunately come as we age. And if you are in fact prepared for those changes, you can be more in control, have more confidence, and actually leverage the healthcare system to get out of it what it is that you want and what it is that you need. Now, I experienced the healthcare system first as a nurse, and then, of course, as a caregiver and an advocate and a daughter with my own parents moving in and out of the healthcare system. This book really came to me over 10 years ago when I experienced some unexpected outcomes of health, advocating for a loved one moving through that system. And it's really there that the seeds of this book were planted. Even as a provider who understood the insides of the systems, I was unprepared, and I was not able to advocate as well as I could have been had I had a guide and a system and a plan as we moved into a hospital or a nursing home or rehab setting with a loved one. So I saw this gap, I think today, with the pressures that the staff in healthcare are facing. So now we're post pandemic. There's tons of media that talks about the pressure on nurses, nursing assistants, physicians. There's a lot of pressure in the healthcare system. And when you enter that system, I don't want you to get lost. And I don't want you to be just surviving that. I really want you to thrive in a system where you can get information and data that you need to make the right decision for your own health and your own care. So bringing this book together for me was very personal, very professional. I really want readers, and you're correct. If you're not over 50, you probably have a parent or a loved one over 50, and you can help them by sharing this book, sending them a digital copy, helping them to think ahead and get prepared, because change comes as we age. And if you are ready for it, you'll have a more successful outcome, especially given the stress and strain on the healthcare system today. The the thought that we would rely on the system and one person in that system to really be accountable and own and advocate is a bit of a myth. And you really have to take that on yourself. And this book will teach you how to do that.
Amazing. And I know one of the reasons why I said it couldn't have come at a better time is I know for me and for a lot of our viewers and a lot of people out there, like we're in this spot now where we have young kids. So my kids are 8. I have an older parent who's not old by any stretch, but she's, 66, lives with us. So we're in that dual caregiver role. And the pressures from that can seem so overwhelming when you're trying to figure out how to parent. First of all, like, what do I need to remember? But then you're trying to figure out how to care for the person that has cared for you your whole life. And it all feels overwhelming sometimes. It all feels new. It all feels scary. And so, in working with you on Prepared and seeing the guides and the steps and the things that you recommend, it just strikes me as such an asset, right? We don't get a manual for how to raise our kids, but to be able to have a manual for how to help our parents through their health changes kind of takes a bit of that pressure off. And
I
I know,
appreciate.
Go ahead.
I was gonna say I appreciate that perspective. We refer to that as the sandwich generation, and I think a lot of women in particular find themselves in that caregiver role, like you said, of both raising children and parents. That's exactly the role I was in at the time that my own mother was going through a really serious illness. And, she spent the last 6 months of her life in institutions, in and out of institutions without coming home, without seeing, her primary care doctor, having different hospitalists sort of recommend or make changes in her care without discussing with family. Like, there's so many pressures. Like, you talk a lot about that pressure, and it's very true. Without a guide, without a sense of what do I do, we can very easily feel overwhelmed. And this book is designed to take those feelings and actually talk a lot about the feelings in the book, because it's a real part of of being a caregiver or an advocate, is the emotional drain that that role takes on you, and that it's okay. Embracing those feelings, being prepared for those feelings, and helping yourself to kind of get through. So I appreciate that perspective that you shared around living in a multi-generational household and having both work responsibility and mother responsibility and daughter caregiver responsibilities. I think it would be great if our children came with a guide, but I don't know if anyone could read a guidebook.
No. I know throughout the process you shared an example of from your personal experience when it came to like the medication that someone had to be on, and how your book can help people with those situations. Could you kind of tell that story again, just to illustrate for our listeners, like the kind of support that they or their family can get from Prepared?
I would be happy to. So, setting the stage, I'm a nurse. I've been, in the space 30 years. So I have a tremendous understanding of systems and empathy for providers. I've been that nurse. Like, I have been the nurse who went into the room with a little paper cup with the wrong meds in the cup, and was very grateful for a patient who said to me, I don't think those are mine. Can you double check those? So one of the steps and the tips that I give is to ask every day, what are the medications that your loved one is ordered for? What are the drugs being delivered to your loved one or yourself? If you're, listening to this and you're the person in healthcare, you should know what is in that cup. What are they bringing to you? And what's ordered? And I go back to the point of the order, because this is really the source of this particular error. And and we shared this story because I was literally editing I was in the throes of writing the book, already with a system in my mind and a plan to ask every day about medications when my loved one went into the hospital. And so here was a real example coming just a few months ago that I received the call from the facility as expected. We did a review of medications. The book will tell you that's expected. They had all the right medications on a list in front of them because my family was prepared. They've lived with me a long time. They knew. They went in with their list. And so I was pleased that the hospital had the right medicines. But the next day when I called to do my daily check-in, what are the medicines ordered? I didn't get a call back. I waited. The next day I called again. When I received a call back, there was a very important medication omitted, a medication which thins the blood and prevents blood clotting for someone with heart arrhythmias. So my question had actually resulted in an identification that while they knew 2 days prior these were the right medicines, it had not been ordered. It didn't actually make it through the doctor onto the medication record.
Mm-hmm.
The medication, the error was, at first my question was, well, could you explain why? Because I don't know all these things. I'm a nurse, but I don't always know why a physician might hold a drug in light of the other health conditions that were going on. So my first question is always for information, right? And you'll read about this in Prepared. Be prepared, gather information, ask those why questions. Explain to me why this medicine's not being ordered. The answer was it was an error. It was an omission. We overlooked it. Thanks for calling it out. And then the medicine, should have been restarted that day. It was another 24 hours before the medicine got going. Now, because of the nature of that drug, the therapeutic level in my loved one's blood had come down. They were no longer protected from maybe having that stroke. Mm-hmm. And the physician wanted to keep them inpatient another couple of days. Thankfully, nothing bad happened. They got back on the medicines, levels became therapeutic. The worst was they had to stay a couple extra days in the hospital, which at the time, when you really want to go home, brings up those feelings, right? You feel frustrated. But the good news was that the system had worked. Mm-hmm. Otherwise, the omission may have gone another few days and resulted in a blood clot and a stroke. And those are the kinds of advocacy tips that I bring into Prepared so that if it's you, if it's your loved one, you have a system that you can go into an unknown situation with some known steps of what to do and what to ask. Makes you feel more calm, more in control. And together, the outcome was improved. And that's a big piece of perspective that I think I bring uniquely into this book is that we own our health. We have to be accountable for it. And so right away in getting prepared, one is knowing your medications and what they're for. And so that if something's missing in your souffle cup, you know that there's a pill missing. Or if there's a pink pill and you always took a blue pill or a white pill, you can ask the nurse to explain why is that pink pill there? And she might say, it's the same drug made by a different manufacturer and they color it differently as an explanation. So again, having a system, even for myself, in the process of editing this book, came to be a very important lesson for me to remember. Do these things every day, and you will have a positive outcome, a positive impact on the outcomes of the care you receive.
That's so good. The other, and this ties in with this, your unique position to write this book is, I love your compassionate approach to healthcare workers as human beings, as people that are doing their very best, but are overwhelmed and are as human as the rest of us in that a mistake can be made. And so what I love about your approach in Prepared, because you have that experience as being both a healthcare worker and being someone who loves someone who is receiving care, is how you bring it together in a partnership, a collaboration. It's not, here's how you can make sure people are doing their job right. It's, here's how you can work with your healthcare providers to get the best outcome for everyone. Here's how you can build a team for your healthcare process. And I guess if you could just briefly touch on why we need this collaborative approach towards healthcare versus the, you know, what we sometimes see, the adversarial or, you know, whatnot, and how taking responsibility for our healthcare can help us be a partner in that process.
Absolutely. The collaborative nature, you're spot on. And I use the words accountability as well as empowerment. And really, if I were to think about some of the changes that have occurred in healthcare in my lifetime, and maybe for some of our older parents, we used to engage and trust predominantly in one physician, whether it was your family physician, your town doctor. This was your primary care doctor, and whom you gave all decision making to them. If the doctor said to do it, it would be done. And I know as a nurse, if I made the same recommendation, people would look at me and say, oh, I'm not going to do that. Then their doctor would say to do it. They're like, oh, I have to do it. My doctor said to do it. There's a tremendous amount of authority historically given to our doctor. And while I still think there's a lot of authority that physicians command, and rightfully so, the partnership that you speak of and what I envision is really a partnership where the patient, the human, has an opportunity to really think in the first part of the book, getting prepared. What do you want for yourself? What might your advanced directives look like? What does your everyday really look like in terms of activities of daily living? What do you actually do? And being accountable to your own health. The changes in the healthcare system have brought many different providers. And while our commercial insurance payers and managed care payers will assign us a primary care doctor, the reality is that's really only the person that you're going to see in the community. You will not see that person in an emergency room, in a hospital, in a nursing rehab center, or an acute rehab center. At the times in your life when you really want your primary care doctor, that trusted voice by your side, they are not there in today's system, which means you have to become your own trusted voice and partner with the experts around you, leverage their information, gather the data, ask the questions that Prepared will teach you to ask, so you can bring that information back, maybe have a conversation with your primary care doctor and make the best choices for you. And as you say, there is a demand for collaboration. The pieces of the system are a bit disjointed. The staffing situation, the transfer of information, and I'm telling you, it's come an amazing long way in my lifetime. We've gotten off paper. We've moved into electronic medical record systems. We have tremendous investment by organizations outside of government entities, private companies, who are making incredible investments with the mission of connecting that network of healthcare providers to make it easier for data to flow back and forth. The reality is those connections are not all made. It will be years before they are. And these baby boomers are coming, and the staffing situation is real. So there's no choice but a collaborative partnership where you take tremendous accountability for real-time information about your health and take that through into the healthcare system and come out of that system. There is no one person who's going to think about all your details, remember your passions, remember your goals, and advocate for you any better than you're going to advocate for yourself, or your loved one may advocate for you. And with that awareness, we behave differently as we enter the system.
Amazing. Well, Cheryl, I am so excited, and I truly believe that everybody can benefit from getting their copy of Prepared. So right now it's out in ebook, so everybody can get it on Amazon. I would highly recommend everybody pick up a copy today. We'd love to hear your feedback. And Cheryl, where can people connect with you to see more about what you're doing?
People can connect with me directly on my website, which is www.cherylfield.com. You can send me an email at info@cherylfield.com. I work full-time in the senior software healthcare technology space. So I have access to a lot of resources, and several of those resources you'll find on my website. I like to share freely to enable all of those words that I think about in my mind map for senior care or older care. Advocacy, knowledge, empathy, empowerment. There's a tremendous number of resources on my website to help facilitate that. So if you have the desire, you want to reach out to me, you have a particular question, please feel free to do that on my website.
Awesome. So again, that was www.cherylfield.com for everybody. And congratulations, Cheryl. I hope you find some time today to be really proud of yourself, because this is amazing. This is going to benefit so many.
It is a very exciting day, and I will say 100% without support of family and a team from She Rises and colleagues who encourage along the way. It's a very challenging thing to write a book. It's very easy to talk about writing a book, but when you have the right team around you, the right supports and the right experts, it just seems like a dream. And so I couldn't be more thankful and grateful for your team and my early readers and my family who have supported me through title changes and cover changes and lots of uncertainty in which next step to take. But I am very excited to get this content into the hands of humans around the globe so they can take control of their own health in any system where they receive care with that calm confidence, instead of those feelings we talked about of frustration and uncertainty. And that's really been the whole intent of this book, is to share the systems that I've learned as an insider and as a consumer with everyone around the globe to help improve their health outcome, one story at a time. So thank you.
Amazing. Thank you, Cheryl. And thank you, everybody, for tuning in this morning. Remember to get your copy of Prepared, a healthcare guide for aging adults, on Amazon in ebook today. And in 2 weeks' time, it will be out in paperback. So thank you very much. And everybody, have a great rest of your day.